Hello, everyone, and welcome to our presentation on teenage mental health in the United Kingdom. I'll be introducing our group project. Teenage mental health has become one of the most urgent social challenges in the UK today, affecting young people, families, schools, and wider society. In this video, we will examine the scale of the issue, explore the current leadership approach used to address it, apply relevant leadership theories, and present a practical solution aimed at improving the long term well being of the teenagers across the UK.
So now that we've introduced the issue of teenagers' mental health in the UK, I will analyze the current leadership approach used to address it. So currently the UK mainly uses a collaborative and distributed leadership approach. Responsibility for supporting young people is not held by one organization. Instead, schools, NHS mental health services, local councils, youth charities and social care team work together. A clear example is the government whole school approach to mental health, where schools collaborate with NHS mental health support teams. This shows that leadership decisions are shared across professionals rather than directed from the top. Research shows distributed leadership can improve outcomes in complex social issues because it encourages teamwork and diverse expertise. This approach has been effective in several ways. It allows early identification of mental health problems because teachers, counselors, and health workers can share information. It also reduces stigma because support happens in everyday situations and environments like schools, not just clinical settings. Despite the benefits, there are also limitations. One major issue is inconsistency. Some areas have strong leadership coordination while others lack resources, so young people receive different level of support depending on where they live. Communication between schools and health services can also be slow, which delays help for teenagers who need urgent support. To improve this leadership needs stronger national oversight to ensure every region follows the same standards. More leadership training for school staff and better communication systems between organizations would also make a collaborative model more reliable and efficient. Overall, the UK current leadership study shows good intentions and strong partnerships, but its still impact could be enhanced with clearer coordination and more consistent structures.
Hi, I'm Dheeraj Shah, banner ID B01575340. Today I'm going to talking about depth and breadth of research for the mental health in UK. In the UK today, a silent crisis is unfolding affecting a generation. The mental health of teenagers has reached a critical point with data revealing a stark and concerning trend. According to a 2023 report from the NHS, a staggering 1 in 5 children aged to 18 to 16 have probably mental disorder, and in the older teenager group 20 to 90 years old that number is even higher, nearly 1 in 4. These figures are not just statistics, they represent a significant increase. The prevalence of probable mental disorders in 70 to 90 years old has more than doubled since 2017. Young women are disproportionately affected with rates of probable mental disorder in this age group more than twice as high as young men. Tragically, suicide is the leading cause of death for people aged 5 to 35 in England. This highlights an urgent need to dig deeper into the root causes and implementing effective solutions. A major report, Future Mind, from February 2025, emphasized a massive long-term implication. The impact of childhood mental health problems could lead to over £1 trillion to 1 trillion in lifetime earning across a generation in the UK. Failing to address these issues now creates for costlier outcomes across education, welfare, and physical health services in the future. The government's 2017 Green Paper on Children and Young People's Mental Health accomplished by key measures including the roots of mental health support team in schools and colleges and design mental health lead in every school. Tackling this crisis isn't just about the healthcare, it's about securing healthier, more purposeful future for young people and our society. Early intervention is not just a moral choice, it's an economic necessity. Thank you.
Teenage mental health leadership in the UK. Teenage mental health is a growing challenge in the UK. It's not just a service issue, it's a community issue that needs vision, compassion and collaboration. Our leadership approach focuses on transformational and servant leadership both people-centered and empowering, aimed at long-term positive change. Transformational leadership, introduced by James McGregor Burns and developed by Bernard Bass, transformational leaders inspire people to achieve more than they thought possible through four behaviors: idealized influence, being a positive role model; inspirational motivation, communicating a clear vision; intellectual stimulation, encouraging creativity; individualized consideration, showing care and support. In teenage mental health, this means that creating shaped vision, reducing stigma, and fostering a culture where young people feel heard and valued. For example, a school leader could inspire staff and students to normalize conversations about mental health and support youth led programs. Servant leadership. Introduced by Robert Greenleaf, servant leaders flip the hierarchy. They serve their people. They focus on listening, empathy, personal growth, and community building. In practice, this could mean creating safe spaces for teenagers, encouraging peer mentoring, and co-designing well-being programs with young people themselves. Application to the UK. About 1 in 5 children in UK has a probate mental health disorder, and services are under pressure. Transformational leaders can set a clear vision, like every teenager feels supported and able to seek help without stigma. Servant leaders ensure the vision is youth centered by listening to teenagers' experiences and letting them shape solutions. Together, they drive systematic change and compassionate practice. Alternative theories. Transactional and situational leadership are less suited here because empathy, empowerment, and shared vision matter most. Transformational leadership can depend too much on the single charismatic leader, while servant leadership can be slower due to collaboration. A shared leadership model distributing responsibility across educators, healthcare workers, and youth leaders can overcome the challenges. By combining the vision of transformational leadership with the care and community focus of servant leadership, we can create a framework that listens, inspires, and supports the mental well being of teenagers across the UK.
In the UK today, 1 in 5 young people aged 8 to 25 live with a probable mental health condition. This is a crisis driven by academic pressure, social media, and long NHS waiting times. The current system is fragmented and reactive. We need a proactive, not just a reactive solution. My proposed leadership solution: the Teen Mental Wellness Circuit moves beyond traditional school counseling. It's a mandatory curriculum integrated program based on a system leadership approach. It addresses mental well-being at the school, family, and community level simultaneously. The circuit replaces 1 hour of standard personal, social, health, and economic education weekly with tangible, engaging activities in different zones: nature and nurture, gardening, mindfulness, mind and motion, physical activity, yoga, and creative expression, arts, music. These aren't just one-offs, they are structured, mandatory, led by both trained staffs and older students per mentor. This approach draws a systematic leadership theory to coordinate various stakeholders, teacher, community, students toward a shared outcome. Its strength is holistic, preventative focus. Its weakness is complexity and resources dependency. It also leverages aspects of situational leadership, allowing different activities to meet diverse teenage needs. This is highly feasible. It uses existing school resources and builds local community link. Early intervention is key to long-term effectiveness, reducing the 105 billion annual cost of mental health problems in the UK. Evidence shows that school-based initiatives improve help seeking and reduce stigma. The circuit will build emotional reliance and give young people the coping skill currently eroded by modern pressures.